Every heartbeat you feel right now is a small miracle. Silent, steady, and easily taken for granted. But what if deep inside your chest, your heart has already begun to whisper for help, and you can't hear it? Every year, more than 6 million Americans live with heart failure. Yet, most of them never recognize the early signs until their lives hang in the balance. These warnings rarely shout. They whisper through subtle changes in your body that most people mistake for stress, fatigue, or simply getting older. The truth is far more serious. Your heart, the organ that has kept you alive every second of your life, may already be struggling and sending quiet, desperate signals that something is wrong. In this documentary, we uncover 13 early signs of heart failure that people often overlook. Some will surprise you, like the strange shortness of breath you feel while bending to tie your shoes, or why you suddenly need more pillows just to sleep comfortably. By the end, you'll understand exactly what these signs mean, and how early awareness could save your life, or someone you love. A quick note before we begin. This content is for informational purposes only and not a substitute for professional medical advice. All data and findings are based on peer-reviewed research and verified medical sources. Now let's begin with one of the most overlooked, yet telling signs your heart is in distress. Sign 1. Shortness of breath. When bending forward, it happens in an instant. You lean down to tie your shoes or pick something up from the floor, and suddenly you feel short of breath. Most people shrug it off, but medicine has a name for this symptom: bendopnea. First described in 2014, bendopnea is the sudden onset of breathlessness that appears within 30 seconds of bending forward. Though it may seem insignificant, it's one of the most specific early indicators of heart failure. Here's why. When you bend, the pressure inside your abdomen rises. That pressure pushes upward against your diaphragm and chest, briefly increasing the workload on your heart. For a healthy heart, this is nothing. But for a struggling heart, one already dealing with elevated internal pressure, this simple motion can immediately trigger shortness of breath. Studies published in major cardiology journals reveal that about 30% of heart failure patients experience bendopnea, and it's often associated with advanced stages of the disease. In fact, doctors now consider it a non-invasive way to gauge heart pressure, almost like your body's built-in test. What makes it remarkable is its specificity. Healthy individuals almost never experience it. If you find yourself breathless from merely bending forward, it's not just poor fitness, it could be your heart sounding an alarm. Sign 2. Cold hands and feet. If you've ever wondered why your hands or feet stay cold even when the weather is warm, your circulation might be trying to tell you something. When the heart begins to weaken, it can no longer pump blood effectively to every part of the body. In response, your body goes into survival mode, redirecting blood flow to your most vital organs, the heart and brain. That means less circulation to your hands, feet, and skin. The result? Constantly cold extremities, sometimes with a bluish tint around your nails or lips. There's also a deeper clue that medical professionals look for: a narrow pulse pressure, which is the difference between your upper, systolic, and lower, diastolic, blood pressure readings. When this difference drops below about 40 mmHg, it often signals that your heart's stroke volume, the amount of blood it pumps with each beat, has fallen dangerously low. 3. Swelling in the legs, ankles, or feet. You may notice your shoes fitting tighter, or indentations on your ankles after removing your socks. That puffiness, called edema, is not always a cosmetic issue. It can be a red flag. When your heart's pumping power weakens, blood flow slows down and fluid begins to pool in your lower limbs, where gravity holds it. Over time, that trapped fluid can make your legs feel heavy or sore, especially after standing for long periods. If the swelling worsens in the evening and eases overnight, it's often a sign that your heart, not your kidneys or diet, is to blame. 4. Persistent cough or wheezing. A chronic nagging cough, particularly one that produces white or pink, frothy mucus, could be more than a respiratory issue. This happens when fluid builds up in the lungs, a direct consequence of left-sided heart failure. As the left ventricle weakens, pressure rises in the pulmonary veins, pushing fluid into the airways. The result? Wheezing, coughing, and sometimes even shortness of breath that worsens when you lie flat. Many mistake this for asthma or bronchitis. But if the cough continues, especially alongside other symptoms like swelling or fatigue, the real problem may lie in your heart. Sign 5. Needing more pillows to sleep. It often starts subtly. One extra pillow for comfort, then two. Then before long, you realize you can't lie flat without feeling short of breath. This quiet progression has a medical name, orthopnea, and it's one of the most revealing signs that your heart is struggling. When you lie flat, gravity no longer helps return blood from your legs and lower body. For a weakened heart, that means blood begins to pool in the veins leading back to the lungs. The result is fluid buildup inside the tiny air sacs of your lungs, making it harder to breathe when lying down. To compensate, your body finds ways to keep you comfortable. More pillows, sleeping in a recliner, or propping yourself upright through the night. But what feels like a harmless habit is actually your body's way of adapting to reduced heart function. Research shows that up to 80% of patients with heart failure experience orthopnea. It's not just about preference. It's a signal that your heart can no longer manage the return flow of blood efficiently. So if you've noticed yourself needing more pillows lately just to catch your breath, it's not about comfort, it's about survival. Sign 6. Swelling in the ankles, feet, or legs. Your body has an extraordinary way of showing distress, and sometimes it starts from the ground up. Persistent swelling in the ankles, feet, or lower legs, known medically as peripheral edema, is one of the most visible signs of heart failure. This isn't the mild puffiness that comes from sitting too long. This is swelling that deepens as the day goes on, often leaving your socks or shoes tight by evening. Here's what's happening. When your heart can't pump blood effectively, it causes pressure to build up in your veins. At the same time, your kidneys receive less blood flow and begin to retain salt and water. The extra fluid has nowhere to go, so it leaks into the surrounding tissues, especially in the lower parts of your body, where gravity pulls it down. According to research published in major cardiology journals, around 70% of patients diagnosed with heart failure show some degree of peripheral edema. The swelling is usually symmetrical, affecting both legs equally, and can be tested easily. Press gently on the swollen area. If your finger leaves an indentation that stays for several seconds, that's called pitting edema, and it's a sign worth noting. Swelling that climbs upward from the ankles to the calves and thighs is your body's visible proof that your circulation is faltering and your heart needs help. Sign 7. Dizziness or near fainting spells. Imagine standing up too quickly and feeling the world tilt. The room spins, your vision fades for a moment, and you feel you might collapse. For some, this happens occasionally and seems harmless. But when it becomes frequent or severe, it could point to something far more serious. Your heart's inability to supply consistent blood flow to the brain. Dizziness or fainting, known medically as syncope, can be an early warning sign of heart failure. When your heart is weak, it struggles to maintain the right amount of blood pressure, especially during movement or exertion. Under normal circumstances, when you stand, your body automatically adjusts by tightening blood vessels and increasing heart rate to keep blood flowing upward. But if the heart is failing, these adjustments aren't enough. Blood flow to your brain momentarily drops, leading to lightheadedness, dizziness, or even collapse. Studies suggest that nearly 20% of patients with heart failure experience this type of fainting or near fainting episode. It can be triggered by something as simple as standing up too quickly, walking upstairs, or prolonged standing. What makes this sign dangerous is how easily it's dismissed, blamed on dehydration, fatigue, or stress. But when dizziness appears alongside other symptoms like swelling, breathlessness, or fatigue, it could be a clear cry from your heart that circulation is breaking down. Sign 8. Feeling full after small meals. At first glance, feeling full too quickly seems like a stomach problem, not a heart issue. But in reality, it's one of the most overlooked signs of congestive heart failure. When your heart weakens, it doesn't just affect circulation to your muscles and brain, it also impacts your digestive system. Reduced blood flow to your stomach and intestines slows digestion. Meanwhile, excess fluid begins to accumulate in your abdomen, pressing against your stomach and liver. The result is a constant sense of bloating, early satiety, or nausea, as though there's no space left for food, even after eating very little. This happens because your heart isn't moving blood efficiently through the veins connected to your liver and intestines. The congestion builds pressure in those organs, making digestion uncomfortable. In more advanced cases, this can even cause pain in the upper right side of your abdomen. where the liver becomes swollen and tender. Many people, and even healthcare providers, overlook these digestive symptoms because they don't immediately link them to the heart. But studies show they can appear months before more obvious cardiac symptoms develop. If you find yourself losing appetite or feeling bloated after only a few bites, your digestive system might not be the problem. Your heart might be. Sign 9. Frequent nighttime urination. You fall asleep only to wake up again and again, needing to use the bathroom. For many, this is chalked up to aging, drinking fluids before bed, or just a light sleep cycle. But there's another explanation: your heart. This condition, known as nocturia, is a frequent and often ignored early sign of heart failure. During the day, gravity causes fluid to accumulate in your legs and feet. Because your weakened heart struggles to pump this fluid back upward, it remains there until you lie down at night. Once you recline, gravity redistributes the trapped fluid back into your bloodstream. Your kidneys, suddenly receiving this surge of fluid, go into overdrive, forcing you to urinate several times during the night. Medical studies show that nocturia often appears before other hallmark symptoms of heart failure, like swelling or shortness of breath. Patients report waking up 2, 3, or even 4 times each night, often producing large volumes of urine each time. The key clue here is timing. If you urinate far more at night than during the day, and it's happening regularly, it's not just hydration or age, it's your body signaling a deeper imbalance. Nocturia may seem harmless, but it's your heart's way of showing that it's struggling to manage the body's fluid load. 10. Persistent nausea and loss of appetite. You might not associate your heart with your stomach, but when the heart begins to fail, even digestion is affected. As blood circulation weakens, the digestive organs receive less oxygen-rich blood. This can cause bloating, a feeling of fullness even after a few bites, or ongoing nausea that seems to appear out of nowhere. Some patients describe it as food just sitting there, refusing to move. In advanced cases, the liver and intestines can become congested with fluid, worsening the discomfort. So if your appetite suddenly fades or you begin to feel sick without explanation, your heart may be struggling behind the scenes. 11. Chest pain or pressure. Chest discomfort is often the symptom most people think of, but it's important to understand how it manifests. Heart failure pain doesn't always feel sharp or crushing. It can be a dull ache, tightness, or pressure that spreads to the shoulders, jaw, or back. Sometimes it appears during exertion and fades with rest. Other times it lingers quietly, mistaken for indigestion or muscle strain. This discomfort may signal that the heart muscle itself isn't getting enough blood, a condition called angina, which can lead to or worsen heart failure. Never ignore chest pain, even if it feels mild or inconsistent. It's the body's most urgent warning. 12. Rapid or irregular heartbeat. That strange flutter in your chest, the sudden pounding when you're resting. These sensations are more than uncomfortable. They can be dangerous. When your heart weakens, it often tries to compensate by beating faster or irregularly in an effort to pump enough blood to meet your body's needs. This can feel like palpitations, skipped beats, or a rapid thumping you can feel in your chest or neck. Such irregular rhythms, known as arrhythmias, can make the heart work even harder, worsening heart failure and increasing the risk of stroke or cardiac arrest. If you ever feel your heart racing without reason, don't wait for it to pass. Seek immediate medical attention. 13. Confusion, dizziness, or difficulty concentrating. When your heart's pumping ability declines, the brain receives less oxygen. The result can be sudden confusion, lightheadedness, or trouble focusing on simple tasks. Some people experience fainting spells or disorientation, moments when everything feels like it's slipping away. While these symptoms are easy to blame on stress or fatigue, they're often signs that the heart isn't delivering enough blood to sustain normal brain function. In older adults especially, sudden mental fog or dizziness can be an urgent red flag for heart failure or low cardiac output. Conclusion, a quiet warning from within. Heart failure doesn't always begin with drama. Sometimes it creeps in quietly, disguised as the ordinary symptoms of life: tiredness, swelling, a little shortness of breath. But your body knows. It sends signals long before a crisis strikes. Listening to those whispers could mean the difference between catching heart failure early and facing it too late. If you recognize several of these warning signs, especially in combination, don't dismiss them. Speak with a healthcare professional. A few simple tests can reveal how well your heart is working, and early treatment can restore years of healthy life. Your heart has carried you since the day you were born. It deserves your attention before it's forced to ask for it.